Children are the living message we send to the future. However, they serve as vulnerable spectators, participants, and are often forgotten contributors to our growing society. It is our responsibility to take an active role to support their needs. Plan International has been running its operations in Tanzania to advance children's rights and equality for girls since 1991. Currently operating in 13 regions, the organization focuses on supporting children and their families through child protection, adolescent sexual reproductive health and rights, inclusive quality education, youth economic empowerment, water sanitation and hygiene, humanitarian program, and child sponsorship.
For the last 30 years, we've been working with great support from the government of Tanzania. We appreciate their continued support as we work together in Tanzania. Essential to our work is the support of Plan International member organisations and donors. We thank them all for their generosity and commitment as we work together to advance children's rights and equality for girls.
From our interventions, Plan International has empowered children and young people, especially girls, to challenge harmful social norms that contribute to different forms of violence, including physical, emotional, sexual, and exploitation. We have been working with girls and boys in implementing multisectoral interventions on ending child marriage, female genital mutilation, and addressing worst forms of child labor. And we have been playing a big role in supporting strengthening of the child protection mechanism at community level to strengthen the prevention and response of cases that are affecting girls and boys at community level.
Plan International works with the government and partners to create awareness among adolescent boys and girls on their rights to sexual reproductive health and rights. We do this through different trainings. We do trainings to peer educators, to health providers and paraprofessionals, and they provide adequate information and services to both adolescent boys and girls. We do also collaborate with young people and community leaders in the community. Through the sports bonanzas, adolescent boys and girls access and participate different sports activities, but again in the same avenue, we also provide adequate and proper information on sexual reproductive health to the adolescents.
Plan International works closely with the government of Tanzania and partners on provision of education to improve learning outcomes, particularly in public schools, to help reduce school dropouts. This is done through construction of classrooms, hostels for students, residency facilities for teachers, provision of sports facilities, and teacher trainings.
Baada ya kupata mafunzo ya KK3 kusoma, kuhesabu na kuandika, imerahisishia walimu kwenye ufundishaji na imetuongezea ujuzi katika kufundisha. Kwa sababu kwenye haya mafunzo pia Plan unatufundisha jinsi ya kutengeneza zana. Kwa hiyo ile zana inamwezesha mwanafunzi kujifunza kwa haraka. Imewasaidia wanafunzi kuanza kutambua herufi kwa ufasaha, kuzitamka kwa ufasaha. Pia imeongeza idadi kubwa ya wanafunzi wanaojua kusoma na kuandika.
Shirika la Plan wameshiriki katika kujenga vyoo vya wanafunzi. Vile vile katika jamii wamejenga vyoo kwa wananchi. Vile vile katika shule yetu nyumba za walimu zimejengwa na madarasa yalikuwa mabovu. Hawa Plan waliyakarabati.
Youth in Tanzania are faced with a number of challenges, despite the fact that they make up to 28% of the workforce. Many can neither access vocational training or higher learning, which could qualify them to access decent work opportunities. Plan International partners with the government and other stakeholders to improve their livelihoods through vocational, entrepreneurship, financial, and life skills trainings.
Kupitia mradi wa vijana maisha na kazi, tulianza kwa kupatiwa mafunzo ya stadi za maisha. Tukapewa namna ya kuchangamkia fursa ambazo zinatuzunguka.
tulikaa sisi kama kikundi na kushauriana kwamba tutengeneze mradi ambao tutaufanya sisi kama kikundi utakao tuwezesha kupiga hatua. Tulikubaliana tufungue ofisi ya aluminium. Mungu alitusaidia tukapata kazi kadha wa kadha. Faida tuliyoipata, tuliweza kufungua ofisi nyingine. Mpaka sasa tuna ofisi 3 ambazo zinatuwezesha kupata pesa ya kujikimu. Tumenunua pikipiki na sasa tuko mbioni tunaelekea kununua kilikuu kwa ajili ya kubebea material kwa ajili ya kufanya kazi.
Mategemeo yetu ya mbele makubwa zaidi kuwa na viwanda vidogo vidogo pamoja na kuwa wajasiriamali wakubwa ili hatimaye tuweze kuuza biashara yetu mikoani na hata nchi nzima kwa ujumla na sehemu nyingine.
We work in partnership with the government, implementing partners, stakeholders, and communities themselves to help communities access improved sanitation facilities and ensure changed sanitation and hygiene behaviors through equity and inclusion to ensure no one is left behind, especially vulnerable groups and marginalized populations. This is achieved through implementation of community-led total sanitation, promotion of functional hand-washing facilities, integration of menstrual hygiene programming, enhancing supply chain of sanitation and hygiene goods, and upgrading sanitation and hygiene services in schools and healthcare facilities. Plan International Tanzania works with around 200,000 Burundian refugees in Nduta and Mtendeli camps in Kigoma to ensure children are protected and have individual case management and access to safe and protected spaces. Since 2015, the organization has increased livelihood opportunities to help Burundian refugees and surrounding community youth, especially adolescent girls, become active community mobilizers with improved access to quality and equitable secondary school education for all refugee children, especially adolescent girls in the refugee camps. Through child sponsorship, a sponsor supports a child who is identified by his or her community. The pool of funds from different sponsors enables the implementation of community programs that are focused towards strengthening of child protection systems within communities, provision of inclusive and quality education, access to clean and safe water, access to healthcare, and protection of children during emergencies.
Mimi ni mtoto rafiki na nimeanza kuwa mtoto rafiki tangu nilipokuwa darasa la kwanza. Plan wametupa kadi za hospitali. Alafu pili nimenufaika katika msichana kujitambua. Nimejijengea uwezo wa kujiamini darasani.
Nilipata ufadhili wa Plan tangu nikiwa mdogo na miaka 3. Plan ilinisaidia kwa nyanja mbalimbali, kimasomo, kiuchumi na kijamii pia. Kupitia programu zake nyingi za kule shuleni kama ile club ya haki za watoto ilinijengea uwezo kwamba nikawa nazifahamu haki zangu, lakini pia kupitia programu za take over ikanijengea uwezo wa kujiamini na uthubutu kama msichana kwamba I can become whatever I want, na hiko kitu kimenipa chachu kwamba nimeweza kupigania ndoto zangu mpaka leo hii na somea udaktari.